To show you how easy it is to file a claim with Geico, we hired a nature show host.
In the native habitat of a suburban driveway, the poor victim of a broken windshield is left assessing his vehicle, utterly helpless.
Well, not true. If he's got Geico, he can file a claim online, over the phone, or with his handy mobile app.
But like a lone gazelle, he'll suddenly be left to fend for himself, awaiting his terrible fate.
Nope. Geico will assign him a designated claims team to help him out too.
So the gazelle gets his car fixed and everything. Wow, nature is so cool.
Geico. Great service without all the drama.
Ladies, we want to meet you where you are. Welcome to the Dare to Ask podcast. Episode 6, Deep in the Heart.
Right from the age of 6, I actually knew I was going to be a doctor.
I'm Corey Jensen, your host for this Dare to Ask podcast. I'm a mom to a big family and have delivered 5 babies. And like many women, I try to stay informed about my wellness as well as the health of my kids. We've created a space to have open conversation about what's going on with the woman's body without feeling intimidated in a clinical setting. A place to talk like girlfriends do. A space that dares to ask.
We're here to make a connection, be authentic, and really get to know your provider. Yes, know the person behind the stethoscope. Dare to Ask will be where you hear the questions that we are all curious to know, but just need a space to do it. You've landed on the Dare to Ask podcast, show hosted by Corey Jensen and sponsored by Essentia Health.
And I love cardiology.
Okay.
It gets me all excited.
Dr. Lola gave me the fever. Yeah, I'm using a little health pun there, but what I mean is she made me excited to go to work. When you hear her love for medicine and specifically the field of cardiology, you just might catch it too. To find that kind of joy at work, it's contagious. So do your best to have an open mind and open heart for this episode because Dr. Lola has not only a beautiful perspective on life, motherhood, and even grief, but some incredible wellness nuggets. We're going to find out her thoughts on why she thinks women don't take care of their heart health as seriously as men do, and why women who don't have artery blockage or women who are pregnant are more at risk than they think. And because I dare to ask it, I want the skinny, undrinking wine and your heart. She's going to simplify how much you should actually drink down to a letter, literally. And she gets vulnerable when we talk about her greatest motivation, a full heart of great things. So let's get to it.
Lola, Olule.
Your name is so beautiful.
Thank you.
Beautiful. And where are you from?
Nigeria?
People call you Dr. Lola.
Yes.
Have you always been Lola?
So it's part of the Oludamilola. Oludamilola.
Lola.
So that's the Lola. So my name basically means God bless me. Just tell people to sing it. If you can sing it, just let it roll off your tongue.
That's cute.
Oludamilola. Yeah.
Your name could be a song.
There's actually a song titled Lola. A patient of mine actually told me about it, and I had to Google it. So there's actually a song.
Are you talking about the Barry Manilow?
Yes. What Lola wants, Lola gets. Yes.
Does that apply to you?
Yes.
Yes. Oh my gosh. I wish everybody could see your eyebrows go up. What's your favorite emoji to use?
Okay, that's a serious question. It's a laugh out loud.
Like just saying LOL?
Yeah, it's mainly with my friends. Like we crack jokes and we just make fun of each other. And we catch up, make fun of the news, politics the last year. You know, try to have fun in the midst of all the COVID pandemic. So
absolutely.
Yes, just to keep our sanity. So
what else do you do to keep your sanity outside of LOLing your friends?
I'm a helpless romantic, I guess. So I love watching romantic series. Then I can watch it from like beginning to the end.
I love that that's our culture now. Binge watch full series of things.
Yes.
It's the best.
It just must not be more than 24 episodes. Though.
Right.
Yeah.
Okay, so let's get into actual real talk here. I
am a non-invasive cardiologist at Essentia.
When we've reached cardiologist, this is a big deal. Credit needs to be given where credit is due. All the women power vibes going on in the room right now.
Okay.
Will you tell me, how did little Lola, or was it big Lola, decide she wanted to go into medicine, ultimately become a cardiologist?
So right from the age of 6, I actually knew I was going to be a doctor.
You did?
Yes. My uncle is a doctor, so just like a general practitioner, family medicine. This is back home in Nigeria, by the way. My parents, so my dad is an engineer, my mom is a retired, like a banker. So it's not like I had exposure to medicine, but I just kind of loved the way my uncle carried married himself and now he cared for people. Okay, yeah, I'm going to be a doctor. Usually when you ask a kid, over time, like, at the age of 10, what are you going to be in future? They kind of say different things.
Oh my gosh, all over the board.
But I kept on saying doctor, pre-med and everything. I just kind of kept on that same tenacity. Initially, I actually wanted to be a pediatrician. I love kids. With kids, once they're sick and you can figure out what the problem is. So it's like a puzzle when you're trying to figure it out because you can't communicate with them. They can't complain to you.
Right.
But once you can figure out that puzzle and you fix it, they get better within like 24 hours and they're running all over it. But then I moved here in 2010. I moved to the U.S. in 2010. I did my master's in public health. That was when I had to decide, what do I want to do? I'd finished my medicine, so I was already a doctor. But then I was kind of deciding, do I still want to do pediatrics or do I want to do something else? So during my master's in public health, I kind of focused more on cardiovascular epidemiology, and that was kind of what set the tone for, did my residency in internal medicine and then went into cardiology. And I love cardiology. It gets me all excited.
Hone in on this I feel at home moment.
I'm not sure there was an aha moment like that. I usually tell people that once you do what you love, then it doesn't feel like work. And that is just the way I feel. Every time I go to work, I'm all excited because I love to do what I do. Like I see the heart and I can explain every single thing that is going on. There's this disorder going on. From what I see, I can explain the symptoms the patient can have. Kind of simple for me to understand, and I just love it. And the fact that, there's so much advancement in technology with cardiology, where previously people used to, have to do so much surgery for valve disorders, and now you don't have to do an open heart surgery. All you need to do is you can put a new valve through kind of non-invasive. So that has made a lot of difference. And now again, you can get patients, for example, with irregular heartbeats, with atrial fibrillation off blood thinners, if that risk of bleeding. So there's so much advancement that, it just gets you all excited that you don't know what's going to be up in cardiology for the next 10 years. And you just want to save lives and make a difference, I guess.
You've got me just so excited for you. If you knew and focused, honed in on cardiology, what we're looking at about a decade of this now, maybe?
Yeah, about 10 years.
Okay.
Yes.
Where did you first move when you moved to the States?
So I went to University of Minnesota. So I have family. So that's why I'm basically in the Midwest. I have family in Minnesota. So I moved in with them, actually. So they kind of helped me settle down. The first snow was like a culture shock. Back home, it's almost like as warm as Florida. They actually had a snowstorm where they had almost 25 inches of snow on the floor my first year. So yes.
Major shock. Then, of course, that entire geographical shock of all of this snow. I'm in the Midwest. I'm so glad that you had a support system immediately when you got here.
That was what made me move, because my parents were not going to allow me move without a support system, especially my mom. She was really particular, and she initially didn't want me to leave, but then, now I'm going a little personal, but then I was already dating my husband right now.
Oh, so you met him in Nigeria?
I met him in Nigeria. We actually dated for years. Oh my God. We started dating in 2005, didn't get married in 2012. So he was already here in 2009. He was in Atlanta. So I'm like, my boyfriend is there. I need to move. So then the question was, are you going to Atlanta or are you going somewhere where we know more people? And it's not like you're married yet. So we didn't want, we don't want you to go to Atlanta. So then
I can see mom and dad, they have an influence here. They really do.
Yes, they do. Yeah.
And when you are a brilliant young woman, I can see why they want to be very protective of you. At University of Minnesota, what next?
Did my master's. The main driving force, who is still a mentor to me, is Dr. Aaron Folsom. Is popular when it comes to cardiovascular epidemiology. It was also one of the people that kind of helped me decide that, I was going to go into cardiology. And since I was in University of Minnesota, I decided to do my residency there also, so I didn't have to move. So I spent like 5 years in Minnesota, and then I was like, oh, okay, I think I'm done with this weather. I need to go somewhere a little bit warmer to see what it is like. I actually went to Mayo Clinic in Jacksonville, Florida, and then I spent 3 years. During that period, I had my daughter, and then at that point, we had to start deciding because one, it was too hot for my daughter. She just wouldn't take it. Her skin just kept flaring up, lots of, medical issues, and we're just like, okay, I guess it's time to move back to the cold. So then we had to come back to the Midwest, and so far she's been doing better. So
that's great.
Yes, we love the cold now.
Now we love the cold. The thing is you speak of such flexibility, doing it with a positive attitude.
Yes.
That's fantastic.
Yeah.
How many kids do you have?
I have one so far.
So your daughter, and how old is she?
She's 3.5. I haven't been able to convince myself yet about getting a second one. I'm going to get a second one, but yeah, by God's grace. Just psychologically, I'm not there yet. I just hope that at some point I'll get there quickly, just because age is also not on my side. But yes, hopefully I get there sooner.
Okay, since you brought up age, how old are you?
Oh, are we going to say that?
You don't have to.
Okay. I always tell my patients I don't like to tell them my age.
That's perfectly fine.
Just because they tell me I look so young. So I love that when they think I'm in my 20s.
3.5 years old. Where are we at? Is she in preschool yet?
She's in preschool.
Yeah. How's she adjusting to that? She
loves it. So she's very friendly. Her dad is an extrovert. I'm more of a little bit of an introvert. So she has more of his behavior.
Okay.
So she knows how to like crack jokes and, get people to kind of love her. So she has lots and lots of friends in school. She doesn't like to be at home. She just always wants to be outside.
A little social butterfly.
Yes.
And you talk of having more eventually when you want to. How does being a cardiologist, having young kids, how do you balance family and profession?
I would say it is tough. And the main reason why I say that is, Mommy, you work too much. It's just like you're never home, So it's trying to find that time where I can balance both work and home, and also time for her, so that she doesn't feel like I'm not there.
Right.
So most of the time, weekends are for her. At times we go manicure, pedicure, just to have some fun and make sure that she still has that confidence in me. I think the only good thing at the end of the day is that times she tells me, oh, Mom, I'm going to be a doctor. I know she probably might change her mind, but yeah.
She's giving Mommy a huge smile right now.
It's just like she cracks me up at times, For example, yesterday, she's like, oh, Mommy, I want something. And I'm like, oh, you got to go make some money to buy that. And she goes, oh, I need to go get my pager so I can go to work. So I'm like, oh, God, okay.
It's just amazing what these little people are able to pick up at such a young age.
Yes, they pick up a lot. Mirror us, basically.
They really do. It puts a little extra added pressure on us.
Yes.
That is for sure, that there's always little eyes watching, and they take in so much.
Yes.
I want to get back to your medicine work and your practice. How did you land in Fargo with Essentia Health? How long have you been here? 2.5 years, going on 3, I guess.
Yeah.
Tell me a little bit more about where that fire and that passion. You love the heart. What part of patient experience do you love? Is it getting to know your patient? Is it trying to find the problem and the fix?
Both.
It's both.
Yeah. So I love to take my patient as a whole, not just what they're there for. So just the medical part. No, because everything works together. Your social life works together. Your emotional life, your family life all plays into your medical part. So I usually know my patient as a whole, who comes in with them, which family member. What stressors are they going on? What stressors do they have in life, so that we can work together to at least, figure that out, because I know that plays a lot with how much they get better. Also, I try to figure out what's going on. So, for example, a lot of my patients at times will say, oh, nobody's listening to me. I keep having these complaints and nobody, they just tell me it's all in my head. I'm like, no, I'm here to listen. Just lay it all on me and we'll figure it out. I love puzzles, just like I said, when I want to do pediatrics. So I try to figure out, okay, what's going on, and I listen to them. After all the multiple tests, just kind of going through the tests and showing them, and now their eyes just open up and they're understanding every single thing. Like, oh my God, so this is what's going on. Oh my God, Dr. Lola, thank you. So, just that joy on their face, just gives me joy and makes me content. They're really grateful, but this is just me, and just the fact that the joy I see and how it kind of gets to me and makes me all satisfied.
And then, of course, there is the fix that you like too.
And then the fact that, the symptoms get better, they get better, that just gives me so much joy.
Let's do a little myth busting if we can, because I feel like cardiology, this has been a practice that's been around for many, many years. It's very thoroughly researched. We are constantly making advancements. However, there's one area specifically, since this is a podcast that really is toward women's health, women and heart health. There is just still so much that women are not taking seriously about their hearts. It down to like, oh, well, there's no way I'd be having a heart attack. I don't have XYZ going on.
Yeah.
It's like we've put all of the symptoms like this only happens to men.
In terms of that, the first thing I always tell women is chest pain is not the only symptom of a heart attack, especially in females. It shows up differently. So, for example, they could have fatigue, they could have, difficulty breathing. At times, it's just like reflux disease. They just think it's acid reflux. Or at times they say, oh, I have a little bit of chest pain, but then they wave it off because they're too busy to focus on that chest pain or just go to the doctor and talk about it. So I always tell people, especially females, is that you're also at risk of having a heart attack. And every time you have any symptoms, you should at least let us know so that we can figure it out. There are some other risk factors. So, for example, when women have things like high blood pressure when they're pregnant, some things called preeclampsia, or they reach menopause sooner, they're actually at a higher risk of having a heart attack. So we always like to have those people see us, sooner.
Yeah.
The other thing is some people say, oh, it doesn't run in my family, a history of heart attack, so I'm fine. No. Or I'm too young to have a heart attack. No. In females nowadays, we're actually seeing what we call with menocar. So it's basically myocardial infarction with non-obstructive coronary artery disease. When people have a heart attack, you actually see like a blockage. But at times in females, we don't necessarily see a blockage and they've had a heart attack. So we always tell people, irrespective of your symptoms, you should come in. This is more common in patients that are very anxious, or patients that just had babies, so around pregnancy, or, kind of perimenopausal. Take those kind of symptoms seriously and come in, because it can cause damage to their heart function.
Of
If we catch it sooner, that'll be better and we can save their lives. Yeah.
My mother-in-law had a major back surgery in early December, and she had a post-operative heart attack with no other signs of heart issues. And it was like opening a Pandora's box. Cardiac disease. And she ended up having 7 stents put into her heart. And it was very fascinating to start digging into this and have them say, you know what, we do think there might have been some mild heart attacks much prior to this.
Yes.
And one of the most curious symptoms that she waved off entirely was, a few months prior, had terrible teeth pain.
Yes. Jaw pain, teeth pain, yes. Yes.
Why did that seem like just a bombshell? Those little puzzle pieces to share with your doctor, even if you think it's so silly or minuscule.
Yes.
Go ahead and share.
Yeah.
What is one practice, like a wellness nugget for women that we can hopefully be preventative, any kind of heart issue, or just having a healthy heart? What can we do?
Yeah. So I tell people to start young. You're not too young to start staying healthy as a female. So what I tell people is, what's your diet? Usually I recommend like the Mediterranean diet, because that has been shown to help with prevention a lot. And that's basically kind of like low carbs. So kind of, less pasta, less rice, less bread, less potatoes, eating more fish like salmon, more white meats, less red meats, less processed food, more veggies, and also kind of more legumes and, fruits as much as possible. I also tell people to exercise as much as you can, moderate exercise for maybe like 150 minutes a week, or if you want to go the vigorous, which involves running, then you can do like 75 minutes a week. Also kind of like alcohol in moderation is also good. For females, it's kind of like 1 glass a day.
Yeah,
of wine, which most
Don't
people
look
don't
at me.
agree
What?
with me. Sorry, I had to because most people are like, oh my God, Dr. Lola.
But I heard red wine is good for your heart.
Yes, it is, but one is the perfect.
Okay.
It's kind of like a J-curve association. So if you don't drink at all, so if you don't drink, your risk is high. But if you drink a little bit, like 1 glass, then your risk goes lower.
Yeah.
And then the J starts, goes up once you start drinking more alcohol. So your risk kind of increases once you drink more.
Simplified so many stories and studies that I have perused in one explanation of the J. I will take that with me to my grave, and I am not kidding. I will never forget that. Okay, so let's say, for instance, we've had a heart attack, we have heart disease, we're now on totally different things, we're new medicines, we're all of this. Can we work up to eventually more vigorous exercise? Is that on the horizon, or is that something you have to take off the table for the rest of your life?
Oh, you have to exercise. So that's actually a myth that most people say, is that, oh, I don't have to exercise after I have a heart attack. No, you do actually have to exercise. And usually when people have a heart attack, we tell them to go to what we call cardiac rehab. And that's because it kind of helps. It's actually been shown to increase survival, get yourself exercising again. So with that, they kind of get them into a little bit of moderate exercise / vigorous, kind of increase their heart rate a little bit to about 75-85%, so that they can kind of slowly get better. And once they're done with their sessions, usually about 12 sessions or 12 weeks, then they tell you to keep exercising on your own and not just, stay. And that's because some people think that when you put in their stents that their heart disease is fixed. No
more worry.
It does not fix your heart disease. You have to do all the things, the preventative stuff. Your diet, your weight loss. Make sure that if you have diabetes, it's under control. Make sure your blood pressure is under control. Alcohol, as we said. And if you smoke tobacco, it is time to stop smoking. Yeah.
The heart is a muscle.
It is a muscle.
So therefore, when we work out, we have to.
Yes.
We have to maintain that level of health.
Yes.
We can't let that deterioration happen.
Yeah.
Our health will start going downhill then. Is there a practice that you do every single day that you think helps you, whether it's for your health, your sanity?
Take 30 minutes to myself after work, just myself, just kind of debrief and just taking a deep breath so that, just before getting in with my daughter, getting on with my husband, I can kind of get my sanity back.
Yeah. So you take the stethoscope off.
Yeah.
And before you put mom hat and wife hat on, you've got 30 minutes for yourself.
Yeah.
What do you like to do in that practice?
I just take in deep breaths. Just sit down, taking deep breaths. Nothing big. I don't exercise during that time. My exercise period is done earlier in the morning as much as possible. So
you deserve it. I think we all need to say that as women again and again. We deserve it.
Yes, we do. I think it helps your sanity.
Before we wrap things up today, with the pandemic and heart health, some people are thinking, well, if it's not COVID related, I can put off some of these doctor visits. What would you say to those people now?
I would say please come for your doctor's visit. And the reason why is COVID, the first wave, people were not coming to the hospital and they had medical conditions. Some ran out of their meds. So by the time we had the second wave, most of them were getting hospitalized in the hospital because they were sicker than where they started from before COVID. And then when they then get infected with COVID, it just kind of just goes really down the drain. So usually we encourage people, just keep up with your clinic visit. Now they're doing telehealth visits. So if you do not feel comfortable coming into clinic, it's okay for you to do video visits or even telephone call visits with your doctor so they at least know that you're doing well. And if you have any complaints, they can address it and order any tests that needs to be done to make you feel better.
I think it's one of the best things that has come out of this pandemic is that evolution of technology and our ease of use of it. And just knowing that it's that touchstone, at least by that touchstone and the questions answered in the communication, you can see if no, this is major. You need to come in and see me. There's oftentimes it's just that touching base and some med changes or some other insightful knowledge that you lovely providers and doctors can can pass on to us. I'm uplifted by that change, and hopefully people will feel more comfortable using it and take advantage.
People are. I think it's just, the older people still struggle with it, but that's where the telephone call comes in. Because we can always make a telephone call.
You have been a treat to me today. What is your greatest motivation to do what you do?
I guess my greatest motivation are my parents, just because they did every single thing to get me to where I'm at.
Since you've lived here for so long now, and they in Nigeria, how difficult is that?
I think the most painful part of everything is my mom passed away in 2015. She had a stroke, and this was before I started my cardiology fellowship. So I guess, that's the only thing I've not been able to come to terms with really well, just because I wasn't really there to say goodbye to her. I was still able to go, but 2 weeks afterwards, it still kind of always feels fresh.
I can see why that wound is fresh every day.
Yeah. Times I feel like if she was here, because she was actually supposed to come that year, but she wasn't supposed to come until October, but this was May when this happened. So it was just like, oh my God. And, she presented Ellie to the hospital. She did everything that she was supposed to do. But, back home, they don't have much of the advanced medical stuff that we do here. They did their very, very, very best, but things just didn't work out. I really do want her to see, how far I've come. She did everything, like every single thing she could ever have done. She sacrificed a lot to get each and every one of us, my siblings, me, to where we are at now. So I'm really, really grateful to her. I just wish I could pay her back the best way I can, but I can't.
I think you really are, like, doing the practice that you're doing now, being the woman you are, being the wife and the mama you are. I think she's real proud. I mean, it really depends on your grandiose vision of, like, what is life and what is life after. And I hope that at one point in time that she will be able to tell you for herself that there will be that moment for you.
Yeah.
Grief, it shapes us.
Yes, it does.
It's amazing what kind of level of compassion that you can learn, or oftentimes grief can also offer a whole lot of anger.
Yes.
And you could be driven by anger and fear instead.
Yes.
So just the example you've set before, it just seems you're such a positive person and are driven by that motivation to do your mom well.
It's made it easier for me to empathize with people, especially people that have lost, loved ones too. So that takes and what that involves.
Do you feel like you have given yourself the opportunity to forgive yourself?
I don't think so. I don't think I'm there yet. Yeah. Psychologically and emotionally, it's been tough. At some point, I know I will. I just feel like I could have saved her, I guess. I think that's the only thing that just keeps playing in my head is I could have saved her. We have videos that, like when we do the ceremony, the last rites and the burial and stuff. We have videos like, that they do, and I can't get myself to watch those videos yet. So I think until I get to that point, then I'll know that, yes, I'm forgiving myself. So
I'm a believing person, very spiritual, and so I will say to you, and I hope that you receive it with warmth, I believe that you should forgive yourself, and you will, and I'm looking forward to the day that you do, because I think that there is going to be a whole lot of peace that washes over you. Yeah. The glow around you is bigger than just you, and she helps radiate that.
Yes.
You carry her.
Yeah, I know.
A perfect stranger, i.e. me, can tell.
Initially, I tried to give myself peace, and I couldn't. So I'm also a Christian, so it was God that gave me the peace that I even got 2 years ago. So I know that it's still a work in progress. And I know that at some point I will get there.
I mean, I absolutely feel it every day. Like, one day is great, and I think I'm there. I think I'm more at peace than ever before, that this is what healing looks like. There's no healed, but this is healing. Like, life is going to be healing, not healed. And then there's the next day where I'm a wreck.
Yeah.
I'm back to being angry. I'm upset. And I'm feeling things like, what could have I done to save her?
Yeah.
So hence grief and being fluid. We could talk for hours about this. I could do it over a glass of wine. I don't know about you.
Yeah, just one glass.
Just the one glass. Dr. Lola, thank you so much for coming in. And I hope to have you back on this program again.
Thank you.
Providers that have been on our Dare to Ask podcast and when they get vulnerable. So when Dr. Lola spoke of grief right there, that really said a lot to me. And I learned a lot of things about my heart health. and we can start thinking about heart health as women a little bit more. Looking ahead to our next episode, I cannot wait for you to meet Jamie Zink. She's a physician assistant in family medicine. And when you meet her, you're going to know what I'm talking about, why I'm so excited for this conversation, because she is energetic. She's so relatable. And you just feel good in her company. I'm excited for it. It's on the next episode of the Dare to Ask podcast.
The information contained in this podcast is not intended to be a substitute for personalized professional medical advice, diagnosis, or treatment. The information is general in nature. If you have questions or concerns, please contact your provider.
What's the big deal?
Where can you get pizza, bread twists, specialty chicken, and more for just $5.99 each?
Is it at Domino's?
He hands off hand-tossed pizza and a marble cookie brownie. He's going! There's a lot of variety on the radio and at Domino's too, where you can
Mix and match 2 or more. $5.99 each at Domino's.
2-item minimum. Pan pizza, bone-in wings, and bread bowls will be extra. Ask for this limited time offer. Prices, participation, delivery area, and charges may vary.